Hi, I'm Leyla Bilali. I'm a registered nurse and the co-founder of Dandi Fertility. Today we're going to talk about your IVF medications. So the IVF medications are meant to stimulate more follicle production so that when we go in for an egg retrieval, we're retrieving more than what your body naturally does, which is usually just one, maybe two follicles. Let's talk about the timeline for your IVF medications. Typically, they start on day 2 or day 3 of your cycle, meaning if day 1 of your period, the day that your period starts, is considered day 1, the medications typically start the evening of day 2 or day 3, depending on the protocol that you're on. And then from there, you're on the medications for about 8 to 12 days before the egg retrieval procedure itself. How many medications are involved in the IVF injection process? So depending on the protocol, typically it's 2 to 3 medications. Again, depending on which protocol you're on, that third medication can differ, but the 2 main medications that we start with are Gonal F or Follistim. They're the same pen, they're the FSH, just different brands, and the Menopur, which is a combination of FSH and LH, whereas the pens are just FSH. Now, these are synthetic hormones. They're synthetic to what you already naturally have in your body. And then the third medication, depending on your protocol, it could be a GnRH is what they're called, so Omnitrope or Zomactin. You could be using an antagonist, which would be Cetrotide or Ganirelix. And then you have your trigger shots, which can be 1 or 2 medications depending on how your cycle is going and which protocol you're on. There are several different brand names for the trigger medications, but they are all in essence HCG and or Lupron. What should you avoid when you're going through the IVF process? So we get a lot of questions about what can I do and what can't I do? What should I be eating? Can I be drinking? Just in general, what type of lifestyle modifications do I need to make when I'm going through the IVF process? So when you're going through an egg retrieval, the process for an egg retrieval, medications can be taken in conjunction with the IVF medications. Pretty much all of your medications can be taken. There are a few medications here and there that doctors will advise their patients to come off of before and during the process. But in general, most of our patients who are on even prescription daily medications, they can continue those. In terms of foods to avoid or foods to ingest and drinking and things like that, you can pretty much eat whatever you want. It's not that it changes the outcome of your cycle, it just can change how you feel. So we say to stay away from salty foods throughout the egg retrieval process while you're on the IVF medications. Salty foods can definitely make you feel more bloated, since bloating is already a side effect on its own. Salty foods can make you feel worse. And we also recommend drinking a ton of water, electrolytes, anything to keep your body hydrated. It feels kind of counterintuitive because you're feeling very bloated, but your ovaries are sucking up all the water in your body, so it can lead to dehydration. So we always recommend drinking a ton of water and electrolytes if you can. Drinking alcohol, again, it's not going to ultimately affect your outcome, but it can make you feel worse. So if you are going to drink a glass of wine, we just recommend, again, staying super hydrated with water and electrolytes to kind of just counterbalance that. Some doctors, depending on your own medical history, will advise you not to drink alcohol at all. So definitely defer to your doctor's recommendations. But that's really it for food intake or drink intake. Coffee, 1 small cup of coffee a day is totally fine. And in terms of sex and exercise and things like that, we recommend, if you're going to have sex, to have protected intercourse. So we recommend that you use a condom. We are simulating, hopefully, a lot of eggs, and we just don't know what can happen. Sperm can stay inside the body for 3 to 5 days. Technically, yes, we're controlling your ovulation, but we don't want to take any risks. And so we always recommend, if you're going to have sex, to have protected sex. And oral sex and things like that are okay. But we just recommend in terms of not inseminating all of your eggs. And in terms of exercise, we do want to make sure that you're not doing anything that moves your core around. So no running, no intense spin classes, no boot camp classes. We don't want you doing inversions in yoga or a lot of Pilates moves where you're twisting your core around. The first couple of days is fine. I would say about maybe 3 to 4 days into your medications is when we recommend sticking to these restrictions. Your ovaries are growing in size as we give you the medications for an egg retrieval, and the ligament that they sit on is staying the same size. So what you're doing when you're moving your core around is in essence risking tetherballing your ovary, so it kind of twists on itself. It's called ovarian torsion. It's a medical emergency. It's very painful. You usually know when you have it, but we don't really see it when people stick to these restrictions. So nothing that moves your core around. You can certainly do stationary weights, if you're just doing upper body weights or lower leg movements that aren't moving your core around. But if you're doing squats, for example, don't be doing jump squats and things like that. So stationary weights are okay. And walking is totally fine. Even a stationary bike is fine. But you do want to stick to these so that we don't risk ovarian torsion. Do IVF medications make you gain weight? They don't make you gain actual weight. They're not increasing your body fat. You're not gaining fat. You are, like I said, your ovaries are drawing in all the water and your ovaries are growing in size. So yes, technically you're going to gain weight. That increase in the size of your ovaries is going to weigh something. So you are definitely hanging on to more water and increasing the size of your ovaries. Both of those things can make you gain weight, but it's not like you're gaining fat. Typically, our patients lose that weight after they have their egg retrieval, maybe 7 to 10 days later when they get their period and everything goes back down to baseline. They typically lose that weight. But again, it's not actual weight gain in the regular sense. It's more due to an increase of the size of your ovaries and the water retention that you're getting during this process.